Straightsmile Solutions, straightsmilesolutions.com. I've been sitting on this video for a while. It's going to do one of two things. Either it's going to flop, which is fine, I don't really care, or it's going to blow up and I'm going to get a bunch of hate mail. So we'll see what happens. Ultimately, my goal with my channel, and I tell you guys this honestly, I mean, yes, it does help make a living, which I appreciate. Gives me a lot of flexibility to raise my own kids and take care of my mother-in-law, and I do enjoy that. Not being in an office, having a lot of flexibility, but in addition, it's an ability to spread the word of orthodontics to people all over the world through the internet, and good orthodontics and healthy orthodontics. And there's so many people in countries out there and cities and communities who either don't have access to the education or just can't afford it. So if I can teach you guys how to be the best orthodontist in the United States, which I still think is the best country for healthcare, and we do things really, really well, I can teach you guys how to do anything. And that is my goal. If I can help 500 to 1,000 doctors in my lifetime, I'm pretty sure I've helped more than that already, but let's just be minimal, then they can help so many more patients than I could ever just do in a tiny practice in my community. So that is my goal, hopefully someday, a couple generations from now, my name will still be out there, but we'll see. That is what it is. Okay, so prove me wrong. I'm not saying these things cure sleep apnea. I can't say that. You guys know I can't say that because I'm not a physician. I am a dentist who is an oral health professional, and we're not allowed to diagnose or treatment plan for sleep apnea. Sleep disorder breathing, you can. Sleep apnea, you can't. We can treat sleep apnea if it's diagnosed by a physician. That makes sense. So we have to be very careful. But here's the thing, sleep apnea is everywhere. Every adult is always talking about it. Kids are talking about, parents are talking about sleep disorder breathing, and people are so much more aware than they ever were about how incredibly dangerous the health effects of sleep apnea are. And also just the physical effects, how you look, how you feel, but the morbidity, is terrible, and the risks are very, very high, and it is a very preventable disease. So, there's a lot of things that it starts from how you were conceived, how you are in utero, how the feeding was when you were born, the food you were given as a toddler, how you were supervised when you're eating and chewing. There are so many things that go into whether or not you're going to have sleep apnea. Your diet, is it processed? How you chew, how you eat. As you get older, your sugar intake, your carbs intake. There's so many things that go into obesity. Has a big point on sleep apnea, right? There's also all kinds of other structural things that can happen in your jaw and your face that go into things that happen earlier. Anyways. All right, so sleep apnea happens. Prevalence is very, very high, especially in first world countries. And until recently, the only way to fix it, to cure it, was a CPAP, or to at least slap a Band-Aid on it. It never cures it, right? It just makes it so you don't have it for that night. So I've had a lot of cool conversations in the last year or two, and I've been really sitting on this, and I've had a lot of cool philosophical conversations. And the conversation has not only been me bringing this up, prove me wrong. Can sleep apnea be cured? I know there's some products out there that say they cure it, but I'm saying without a product. Can they be cured by lifestyle and diet choices that you make on your own, is what I'm saying. Choices you make on your own. Can you cure this? Can anyone do this? And does a dentist even have to be involved? And here's the thing, I know at least several immediate family members who have been cured from sleep apnea by making simple diet and lifestyle changes. Sometimes it did involve some orthodontics, sometimes it involved some myofunctional therapy, it might involve tongue release, but losing weight, GLP-1s, hormone replacement therapy, a combination of things to make your body way healthier, like to get yourself healthy again, your body and your mind, and the way your mouth moves and everything like that. And guess what? They had been tested in lab or home sleep study, and it's gone. It is gone long term. So, and they're off their CPAPs, which is very difficult to get off it. These doctors do not want to let you off of it. It's kind of like my doctor won't let me off some of my medication. I'm like, I don't have high blood pressure anymore. Like, you get to still stay on it. But yeah, I know plenty of people, and patients are getting smarter, and they're realizing that there is an entire giant industry out there of doctors getting very rich and people getting very rich off CPAPs. And look, I'm not trying to start a war of the doctors versus the dentists or anything like that, but if there's a way that you can personally be healthier to prevent or eliminate or reduce the likelihood of you having sleep apnea, then the information should be out there for you. So I'm just putting it out there, and this is how you look for research. There's not going to be any research directly about sleep apnea and all this stuff. It's not going to be there because it has not been done yet. And in time, maybe probably not in my lifespan, it won't be. I mean, not anytime soon. But you can look up little things. It can be like airway volume, comma, orthodontics, comma, an expander. I mean, things like that, airway volume, okay? And then you can look up a different piece of research about airway volume and sleep apnea. I mean, that's what I'm saying. No one's connecting these things directly to sleep apnea, but there's indirectly connected. And then you can connect the dots. And that's all I wanted to tell you guys, is just to give you, if you're personally suffering from it, or you have family members or friends, you can't really take this to your patients yet, but you can get yourself healthier. Like I said, again, there's going to be no research on this. It does not exist, and we will get in big trouble. I'll probably even get in trouble by putting this up here. But all I'm doing is opening a dialogue. And I'm just saying, I personally know this to be true, because I personally know of people that I know all their medical stuff that are direct family members that have been cured of it, more than one person. And all they did was GLP-1s, hormones, and things like that, and myo and ortho and nasal breathing and all the things. And boom, poof, gone. So, all right, hopefully that helps. Thanks.